Hey, what's up? Welcome back. In today's video, I will be going over parts of an NG tube. I will also go over NG tube placement, verification. However, if you're new here, welcome. My name is Tina, nurse practitioner. Don't forget to subscribe and turn on that notification bell. Let's get started. The supplies you will need to gather is a Salem Sump NG tube. You will need a pair of gloves. You will need your 60cc syringe. You'll need a water-based lubricant, tape, and or an NG tube securement if you have that, permanent marker, and a flashlight. It does specify the flashlight if you want to check patency of the nares to make sure there's no deviated septum, and then the tongue depressor just in case there is any form of coiling of the tube so you can be able to look at it accurately. I like to include a drape over the patient's chest, and then if the patient does not have a pillow behind their head, I'll also get a small washcloth. I will roll it up and put it behind the patient's neck to help with flexion. So let's go over the parts of the NG tube. So this is the tip of the NG tube. There's little ports inside. That's where the gastric contents will go through if it's connected to suction. This is where you're going to apply the water-based lube. And this is it's nice and soft, so it's gonna go into the nares. As we go down, the length of this is about 80 centimeters in length. And you have your port here. This is where you can connect it to the suction canister. So you will need this little secure device to apply it in there. And then this applies to the suction, which go to the suction canister if the order is for intermediate suction. This blue port, this is like the air vent. Most likely 90% of the time, every medical provider will want this off so then that way it can breathe. Otherwise, it just gets messy. So those are the two things I wanted to discuss. Another thing is once it is in place, I will get a 60cc syringe and obtain just a small amount of gastric contents to verify color. And then I'll order the X-ray to be able to confirm placement. So when I'm measuring landmarks, I'm going to put this on the tip of the nose to the earlobe, as shown here. And then from the earlobe, I'm going to hold it here. I'm going to go down to the xiphoid process till I feel that bony ridge, and I'm going to stop just there. I'm going to apply tape on here. So then that way I know where to stop when I place it inside the patient's nares. I have a towel draped over the patient's chest just in case there's any contents or if it gets messy. I also have a yonk guard to my side and within reach if it's needed. I'm going to put this inside the patient. I have him sitting upright, so I'm going to put this in. At this point, I'm going to have him flex his head forward. He can swallow or he can drink water if he wants to. Once I have advanced it into place, this is where I'm going to apply the tape. So I have it within reach, have it here. I'll wrap it around. Okay, there we go. And then this is where I can obtain a small amount of gastric contents with the 60cc syringe. I'm going to verify it with an X-ray for placement, as that is the best way to verify placement. And then I will notify the doctor and get an order if this will be connected to suction or if I will be administering tube feeds or administering medications. So once placement is verified with an X-ray, I will remove the piece of tape and I will mark it with a permanent marker. So then that way I know exactly where it needs to be every time. Thank you so much for watching. Be sure to hit that like button, give me a big thumbs up, and I will see you on the next one. Take care.